This is Christy Hagens, and myself, as well as Will Mariscal, will be facilitating our webinar today. And we are pleased to actually have a guest presenter, which will talk about some of the issues related to the CRDP and upcoming opportunities. Before we get started, I did want to just mention a few housekeeping pieces so that you're aware of that. One is, you may have noticed that all participants, all of you are currently on mute, and that's to avoid background noise, feedback, interference of any kind. But as we've done in the past, if you have questions that come up live or as we are conducting the webinar, we invite you to submit your questions at any time using the question box. At the end of the webinar, we'll try to leave an opportunity to have the presenter respond to any questions that you all may have. We're also going to have an evaluation at the end, which will pop up, and definitely need and invite and would like your feedback related to that. We'll also be recording the webinar so that it can be available for folks to access at a future time, people who may not be able to be on the call. And in just a minute, I'm going to let you know that we're going to start the recording and we will begin. But I did want to remind you, as I just mentioned, this is our last kind of formal call together. However, you are invited to continue to reach out to us and let us know if you would like technical assistance through the end of June so that we can support you in the work that you've been doing so far. And we hope that the information that you learned today will just supplement all the information that we've covered thus far. So for recording purposes, I'm going to pause for just about 4 or 5 seconds or so as we begin the recording. I'm going to repeat a little bit of this again just so that those who might hear the recording have all the information. So here's a brief pause. You don't need to do or say anything. Just know it'll be silent for a couple seconds. Okay, so welcome to the California Reducing Disparities Project Overview and Update webinar. It's brought to you by the Community Defined Practices Project and the CIBHS Health Equity Team. Our webinar today will provide agencies with a history and overview of the California Reducing Disparities Project, including the 5 population reports, the draft strategic plan, and an update on phase 2. So at this time, I'd like to introduce our speaker for today, Dr. Tamu Nolfo. Dr. Nolfo is a developmental psychologist and Robert Wood Johnson Foundation Fellow who integrates the latest research developments and community needs into strategies for youth and family wellness. Her expertise lies in developing culturally and linguistically appropriate programming and services and training others how to maintain these key elements at the forefront of their planning and implementation efforts. Over the course of her career, she has served as a classroom educator, direct service provider, and program director, as well as a program designer, coalition coordinator, technical assistance provider, evaluator, and researcher. Dr. Nolfo currently serves as the California Department of Public Health Office of Health Equity, where she has been instrumental in developing and implementing the inaugural California statewide plan to promote health and mental health equity. So it's my pleasure to turn the mic over to Dr. Nolfo and have her share her wisdom and expertise with us.
Thank you. Thank you for having me here today. Yes, my name is Tamu Nolfo, and I am a senior project manager in service to the Office of Health Equity at the California Department of Public Health through a partnership with the Center for Health Program Management. And today I've been asked to present an overview and update on the California Reducing Disparities Project. And I will say that just from the very top, that although I would like to be able to answer lots and lots of questions on this webinar today, I may not be able to, which we'll get into later in the webinar. We're in an open procurement period, and so I've been asked by the office to really provide the same exact information on today's webinar as any other group would receive, which means that it's fairly scripted, and because of that, that ensures a level playing field for anyone who might want to apply for the funds that I'm going to be discussing in this presentation. So I just wanted to give you a little heads up on that. Throughout my presentation, I will be highlighting the 5 CRDP, or California Reducing Disparities Project, population reports, the draft strategic plan, and other pertinent information related to the CRDP. The web address has links to the population reports, contact information for the project leads, and a fact sheet, which includes CRDP Phase 2 efforts. The California Reducing Disparities Project, over a 4-year span of time, mobilized communities in a grassroots effort to elevate the voice of diverse communities. The CRDP is a key statewide policy initiative to raise community-defined evidence, or CDE, which is defined by the National Latino Behavioral Health Association and the National Network to Eliminate Disparities in Behavioral Health as a set of practices that communities have used and determined to yield positive results as determined by community consensus over time, which may or may not have been measured empirically, but have reached a level of acceptance by the community. This initiative is to improve access, quality of care, and increase positive outcomes for racial, ethnic, and LGBTQ communities in the public mental health system. The project focuses on 5 populations, which are African American, Latino, Native American, Asian and Pacific Islander, and lesbian, gay, bisexual, transgender, and questioning individuals. California will be in a position to better serve unserved, underserved, and inappropriately served communities, and to replicate the new strategies, approaches, and knowledge across the state and nation. In 2001, a federal report from the Office of the Surgeon General, U.S. Department of Health and Human Services, entitled Mental Health, Culture, Race, and Ethnicity, a Supplement to Mental Health, reported that racial and ethnic minorities bear a greater burden from unmet mental health needs and thus suffer a greater loss to their overall health and productivity. In July 2003, U.S. Department of Health and Human Services issued a final report entitled The President's New Freedom Commission on Mental Health, Achieving the Promise, Transforming Mental Health Care in America. It reported on the need to reduce disparities for minority communities. Both of these reports placed a national spotlight on the need to reduce mental health disparities for underserved multicultural populations, but also spoke to a systems change approach and promising directions. And here you can see the background, and that the legislature in 2007 approved $1.5 million annually of State Administrative Mental Health Services Act dollars to support the development of a California Reducing Disparities Project strategic plan for the state, that the Mental Health Services Oversight and Accountability Commission would provide policy direction for statewide projects, including ethnic and cultural specific programs and interventions, and that commission would identify CRDP as one of 5 prevention and early intervention statewide projects. Then in 2010, we have the former Department of Mental Health, which executed 7 contracts, 5 to form strategic planning work groups, which we call SPWs, for the 5 communities, which I mentioned: African American, Asian Pacific Islander, lesbian, gay, bisexual, transgender, queer and questioning, Latino, and Native American, and the California MHSA Multicultural Coalition, and the facilitator writer. Then in 2012, you have AB 100, which eliminates the Department of Mental Health for fiscal year 12-13, AB 1467, Omnibus Health Trailer Bill, which creates the Office of Health Equity, and the governor's final budget summary fiscal year 12-13, which allocates the CRDP to the California Department of Public Health, along with $15 million and legislative intent totaling $60 million for Phase 2 implementation and evaluation. California voters passed Proposition 63, now known as the Mental Health Services Act, in November 2004 to expand and improve public mental health services. At that time, California's public mental health funding was insufficient to meet the demand for services. The majority of mental health funding went to treatment for individuals with the most severe and persistent mental illness, state hospitals, and the criminal justice system. For this reason, California's mental health delivery system was frequently portrayed as a fail-first model. The safety net of an underfunded system had become the criminal justice system, the courts, and emergency rooms. California taxpayers approved a 1% tax on incomes above $1 million to fund the MHSA, and MHSA brings in over $1 billion annually. CRDP is less than 1% of all MHSA funding, as you can see from the pie chart. And this is the vision for CRDP, that it is service delivery defined by multicultural communities for multicultural communities. And in it, we have identification of strategies developed across targeted communities to improve outcomes and reduce disparities, implementation of selected community-identified strategies, culturally and linguistically competent community participatory evaluation of community-defined evidence for racial, ethnic, and cultural communities, and replication of approaches to reduce mental health disparities. CRDP Phase 1 included 3 requests for proposals, culminating in 7 contracts in 2010, and is the first of its kind effort in California and possibly throughout the nation. The principal deliverable of the Strategic Planning Work Group contract was the development of population-specific reports that contain an inventory of community-defined, strength-based promising practices, models, and/or other resources and approaches that will be helpful to practitioners, program planners, and policymakers in designing and implementing effective prevention and early intervention programs to reduce barriers, improve services to better address mental health needs, and reduce disparities. The population reports developed by each strategic planning work group form the foundation of the CRDP strategic plan. The California Mental Health Services Act Multicultural Coalition, or CMMC, is designed to provide a new platform for racial, ethnic, LGBTQ, and multicultural communities to address historical barriers and provide recommendations on embedding cultural and linguistic competence into the public mental health system. Finally, the facilitator writer of the statewide strategic plan was tasked with working closely with all CRDP partners to produce a comprehensive plan. Once finalized, the draft strategic plan will be used as a guide to identify new service delivery approaches for multicultural communities using community-defined evidence to improve outcomes and reduce disparities. The strategic plan will also serve as a blueprint to implement these strategies at the local level. And these are the deliverables from the strategic planning work groups. The goals for the SPW contracts were to identify promising programs and practices, to identify strategies to reduce disparities, and to prepare a population report. Consisting of 12 to 58 SPW members for each targeted population representing various fields in the area of mental health. It served as a guiding and advisory body to project leads. It outreached and engaged over 1,000 community members, and it vetted population reports through the public review processes. So these were all of the things that were done within the strategic planning work groups. The CRDP support team includes a facilitator writer, which is the California Pan-Ethnic Health Network, which works collaboratively with the 5 SPW project managers to ensure the final strategic plan is inclusive of the work completed by the SPWs. Mental Health Association in California, MHSA, has responsibility to organize and mobilize the California Mesa Multicultural Coalition, or CMMC. The CRDP strategic planning work groups and support team have these activity outcomes: to engage respective communities throughout the state, convene focus groups in rural, urban, and geographic regional areas, conduct key informant and cultural broker interviews to identify community strengths, develop the community needs assessments, participate on mental health committees to educate, update, and garner input and feedback, and conduct community forums prior to and after dissemination of the reports. And all of those activities have been done. And here's a graphic of the CRDP population reports, which can all be found online at our website. So in terms of talking about our linkage from CRDP Phase 1, which was to create these population reports and the overall strategic plan, to CRDP Phase 2, let's talk specifically about what happened within Phase 1 and what's happening now in Phase 2. So in CRDP Phase 1, we have the strategic planning work groups, which engaged communities, identified promising programs and practices, identified strategies to reduce disparities, developed the population reports, and contributed to the draft CRDP strategic plan. Then in Phase 2, we're looking at a roadmap to transform the public mental health system into one that meets the needs of all Californians, to implement the strategic plan, and to have a blueprint for the $60 million rollout for CRDP Phase 2 components. The CRDP strategic plan is in draft form at this time, just coming out of a 35-day public comment period, a little bit earlier this year. The public comment period has ended, and the plan is being finalized. We actually received over 800 comments on that plan. So once finalized, the strategic plan will be used as a guide to identify new service delivery approaches for multicultural communities using community-defined evidence to improve outcomes and reduce disparities. The strategic plan will also serve as a blueprint to implement these strategies at the local level. The plan is projected to be released in the summer. In it, we've compiled recommendations from the 5 population reports, categorized into 4 themes and 5 goals and 25 recommendations. We've discussed and prioritized by the CRDP partners for inclusion in the strategic plan and refined and vetted it with CRDP partners. And so all of that is underway now in terms of having a finalized plan that incorporates all of the community input that we've received. There are 3 implementation levels, which you can see on the slide. At the systems level, we have workforce development and capacity building. At the community level, we have community involvement and engagement and community leadership. And at the provider level, we have linguistic access and robust community engagement and cultural brokering. The strategic plan includes 4 overarching themes and 25 long-term strategies within 5 goals to reduce mental health disparities at the statewide and local levels. The 4 themes are to address and incorporate cultural and linguistic competence at all levels, to implement capacity building at all levels, to improve data collection standards at all levels, and to address the social and environmental determinants of health. Within Goal 1, which is to increase access, examples include co-location of services, school centers, prison reentry, and culturally and linguistically appropriate outreach. Goal 2, which is to improve the quality of services, have examples such as culturally and linguistically competent workforce, services, and access to services. Goal 3, which is to build on community strengths to increase the capacity of and empower unserved, underserved, and inappropriately served communities, include examples such as engaging faith communities, working with parents and foster parents and families, and supporting community engagement and leadership. Goal 4, which is to develop, fund, and demonstrate the effectiveness of population-specific and tailored programs, includes examples such as establishing a network of community health workers, funding culturally specific research, allocating funding according to community need, and conducting evaluation of community-defined practices. Goal 5, which is to develop and institutionalize local and statewide infrastructure to support the reduction of mental health disparities, includes examples such as engaging the community in CRDP implementation, replicating models of community engagement, and developing new relationships with the county. And as I mentioned, my talking points today are scripted, and I've been asked to read them specifically as they've been given to me so that the information is imparted from this office in a standard way, consistently offered to stakeholders. This ensures a level playing field as we open the procurement process for putting out $60 million over the next 4 years. So on March 5th, the California Department of Public Health, Office of Health Equity, released draft pre-solicitations for the California Reducing Disparities Project, statewide evaluation team, technical assistance provider, capacity building pilot projects, and implementation pilot projects. And you can see that we put the draft pre-solicitations on our CRDP Phase 2 webpage. The purpose of the draft release was to solicit public feedback about the program and solicitation designs prior to release of the official solicitations. CDPH is not accepting applications at this time until all comments have been reviewed and incorporated as needed. So for CRDP Phase 2 open procurement, feedback was submitted on all applications from a wide range of stakeholders, including consumers. The public comments are now under review for the best manner to address the concerns expressed, and changes are being made to the solicitations. My understanding is that we received over 200 comments. So out of respect to the careful work the commenters have done, the Office of Health Equity is diligently weighing how changes might be implemented and how the changes impact other solicitations. This may delay the release of the final RFPs, but we feel like this is really warranted at this time. When the changes are completed, the solicitations will be put out. Sorry, I have that printed out in front of me. That's okay. So when the changes are completed, the solicitations will be vetted with CDPH leadership for approval and then posted on BidSync for bidding. A thorough bidders conference will immediately follow the release of the solicitations to ensure widespread understanding of the solicitation requirements. Throughout the procurement process, from public comment until the contracts are awarded, the California Department of Public Health, Office of Health Equity must work to ensure all potential proposers have a level playing field and that the department operates in a manner that is transparent to the public. We will not be able to take personal meetings or respond to telephone inquiries regarding the solicitations to ensure a level playing field, full transparency, and the integrity of the solicitations. But if you would like to be sent an Office of Health Equity email announcement, please subscribe at ohe@cdph.ca.gov. And for more information, here's our website. I strongly encourage you to go to the fact sheet link. It is very inclusive and will probably answer just about any question that you have. And then once again, there's the email address if you would like to be added to our e-blast. And that concludes my presentation.
All right. Well, thank you very much. I think Will is going to monitor any questions that may have come up. And this is the invitation, although Tamu has indicated she's not at liberty to answer a whole lot of information. If there are things that she is able to respond to, but that you have questions about, she can let you know whether or not she's able to respond.
That's right.
Please go ahead and use the chat feature to pose any questions, comments, or responses that you have. And I see there's one. And
I do see.
Will, I think, is going to try to read it.
Can you read it?
I can read it. Do you want me to read it out loud
Yes,
for people?
sure.
Thank you for this webinar. My name is Gulshan Yousafzai. I know that I just mutilated that last name. Do you know how to pronounce that? Okay, and I apologize for that. And I am the Executive Director of the Muslim American Society Social Services Foundation. You mentioned the RFPs will be released in the summer. As you might already know, the fasting month for the Muslim community is June 18th through July 18th. Followed by their holiday, July 19th through July 21. If at all possible, please refrain from releasing the RFPs during this time, as it will be very hard for my community who will be fasting from morning until evening for 30 days. Thank you. I will absolutely take this back to the office. I would be surprised if the RFPs were released before then, because really all of the feedback is being incorporated into revising those solicitations at this point. And there are so many levels of approval that need to be worked through within the state that I don't think that we're in jeopardy of putting out the RFPs during that time, but I will absolutely bring those dates back to the office.
I think, Tamu, that the comment that you made earlier was that the final version of the strategic plan was going to be released in the summer. Maybe that might be the confusion. So not the RFPs, but the final draft of the strategic plan after the comments have been incorporated.
Well, you know, we're looking for both of them. And so, but I think that it's more likely that the RFPs will be released in the fall. Yeah. So it really is a matter of just how quickly can we incorporate the comments that we're getting on both the strategic plan and the RFPs. But from what I can tell, it's more likely that the strategic plan is going to be released first. And we have another comment. You mentioned Transform Mental Health Services. Just left a meeting with the LA County's Directors of Mental Health, Health Services, and Public Health, as the LA County Board of Supervisors issued a motion to integrate the three agencies. Given these funds include system change, how will local decisions affect this process? If you can please provide an example for capacity building for systems change. Given these funds include system change, how will local can you help me with interpreting that?
Sure, I'll give it a shot. Okay, Bruce, we'll try to look at it. It's two questions. Did you want to break it up? And the first question is, given funds include system change, how will local decision affect this process? Which funds? Are you saying that if this that the CRDP Phase 2 will include funds for system change? Is that what you're asking, Bruce? And how will that how will local decisions affect that process?
I'm not sure how local decisions will affect the process. What we're looking for are the recommendations that came out of the strategic planning work groups around what it is that they would like to see funded. So, and
then I can address it from another perspective, Bruce. I'll tell you this. I think, again, one of the differences is that there's the strategic plan, which has, and Tamu, you can correct me if I say this wrong.
Sure. Which
has that goal of helping contribute to the redesign of the mental health system in a way that meets that. You had a slide or a bullet that said something like that. That meets the needs of all Californians. So the strategic plan is trying to influence that. Phase 2 is implementing a subset of all the things that are listed. So Phase 2 is smaller than the strategic plan. Phase 2 will not necessarily carry out all of the strategic plan. Is that correct? It's not the intention to carry out all.
That's exactly right.
So there are recommendations in the strategic plan that have to be carried out at the local level. So and so in that sense, Bruce, you use the strategic plan as something, as a leverage or as something to inform, to guide your efforts at the local level for decision making.
Right.
Does that make, okay.
Yeah, absolutely.
So that was the first part of your question. Second question is?
If you can provide an example for capacity building for systems change. So I talked about the examples that were provided to me for this presentation. So within goal 3, for example, build on community strengths to increase the capacity of and empower unserved, underserved, and inappropriately served communities. And some of the examples there are to engage faith communities, work with parents, foster parents and families, and support community engagement and leadership. And so when the strategic plan is released, and the draft plan has been released, but when the final plan is released, then that will be explored more fully. But you're welcome to go online to look at the draft strategic plan to see how this was discussed more fully there about capacity building for systems change.
Yeah, and Bruce, I know from previous meetings that we've had that you're really looking at this opportunity right now in Los Angeles County that's unique, that if they are deciding to do this redesign of the system, it's a perfect time to for people to be at the table to try to advocate that the system be redesigned in a way that it will reduce disparities and promote health equity, rather than to do a redesign that perpetuates some of the structural inequalities that have been there before. So I think, Bruce, you can be using that, at least the draft version of the strategic plan in those, as you advocate for that change to be sensitive to the needs of diverse communities in LA.
And we have another question that's come through under strategic planning work groups. Will other groups be included, such as Middle Easterners and Africans? And so when CRDP was, when it was conceptualized, the 5 groups that were targeted were the ones that I discussed. And it's really a question of whether or not there's going to be another round of CRDP that would be expanded out to other groups. And unfortunately, I don't know that. No one in my office knows that. It's really worth having those conversations with the people who hold the purse strings to advocate for your needs. If you're feeling like some groups have not been included that really should be included, I would say absolutely use the process to continue to advocate around CRDP and additional phases or additional, not phases of CRDP, but whether or not there are going to be additional rounds, essentially, of CRDP, because it's only a 4-year project at this point targeted at those 5 initial groups.
Sine, I just wanted to add that the intention of the CMMC is to have a place where the voice of other communities can be expressed. So the MHSA Multicultural Coalition has representatives of various communities that are much more than what was in the 4 strategic planning work groups.
So 5.
5 strategic planning work groups. So, so I think it's at that place where there is a voice, but I think what Tom was saying, whether or not there will be funding to develop new population reports, that is not that has not been presented by the OHC, whether there would be additional funding for that. So I think that is unknown, but certainly a place that you can ask those questions or advocate is the CMMC. That's a place where those discussions are being held, I think.
Are there additional questions that people have?
Yeah. So now you just raised your hand. Is that in appreciation? Okay, you lowered your hand. Or you had another question you wanted to type? Okay. So I had a question, Tamu. So they have the draft RFPs are available. The draft outline of what the project looks like is available. Of what the phase 2 would look like is available, and everything's being revised based on the feedback that they got, because they had regional meetings on the structure of phase 2, right?
Right. So basically, this has been a very transparent, inclusive process. I don't really know of any other government processes that have been quite as inclusive. As a result, it has kind of taken out the timeline more than I think originally envisioned. But there have been a number of forums and whatnot to provide input into the strategic plan. And as I said, my understanding is that there have been over 800 comments that have been received through that public comment period, and so they are essentially being integrated into that draft strategic plan so that we can have a finalized strategic plan, and that really is to be used as a guide for moving forward with this work to give guidance to local communities in terms of what is it that's being seen as best practice on the ground, and so that is being done at this point, but then also alongside that is putting together the draft solicitations for the RFP process. And so those were put out in early March, and everyone was able to weigh in on them. And we have over 200 comments on what people thought about the solicitations themselves. And so at this point, all of the solicitations are being rewritten to reflect the feedback that was gotten.
Okay. Now, there was one other process that I'm a little confused with. There were also meetings or webinars, maybe in February, around the structure of phase 2. In terms of, I think you only had one slide that outlined it, but I've seen more materials on it that, you know, that there's going to be TA providers per population.
Oh, right.
Going to be. So is that structure finalized, or is that also being revised? Because
I don't know the answer to that, honestly. My understanding is that the structure itself is not being changed, but don't quote me on that because I don't know for sure.
So the resources that you offered on the websites, would it be the fact, where would they find information about this, kind of the general structure of phase 2, what phase 2 is going to look like?
That should be within also the frequently asked questions, which is, if you go to the last slide, the CRDP fact sheet.
Okay.
And so that should provide answers in terms of the structure around CRDP phase 2. But if you do want to go back to that one slide that puts it up, we can take a look at it as well.
So this is all about the procurement, and I know people are really concerned about the RFPs now, but there was a time when they were giving us more information about what it actually looked like, and I'm not seeing the scripted presentation that they've given you does not really outline phase 2.
So the procurement.
I don't see which slide really outlines phase 2.
The ones that went out that we received feedback on were around the evaluation team, the statewide evaluation team, the technical assistance provider, and then the capacity building pilot projects and the implementation pilot projects.
So this slide talks about the structure, but it does it in a sentence.
Yeah.
So the structure of the different opportunities, there's a statewide evaluation team, there's a technical assistance provider component, there's capacity pilot projects and implementation pilot projects.
Right.
So there is a CRDP phase 2 webpage that they can find where they can look at that structure in a little more detail than that I imagine.
There's more, there's more information about all of that on the frequently asked questions.
Okay.
Where you can absolutely learn about what is it that, why do we have these various solicitations and what are we hoping to accomplish with these different components.
Okay.
So about 25% of the funds in this project are actually going to evaluation, because we're really looking to build up the evaluation, you know, for all of these projects so that they can prove their effectiveness. And so, yeah.
So, and just to follow up your response to what it looks like in the structure,
Mm-hmm.
and I know you just mentioned the points.
Yeah.
And that we could go to the website and all of that, but is
Yeah.
there any more detail you can just provide to them about what the population, in terms of what the by populations
right.
will be targeted, but the capacity building process,
right?
And
so
the amount of time.
I don't know if I can talk so much about the amount of time off the top of my head, but the idea behind having the technical assistance provider is really to help organizations that need it in order to be able to move through the process, so that organizations who haven't necessarily gone through this kind of rigorous evaluation, kind of rigorous implementation and working with the state system will not be put in a disadvantaged position. And so that's the real idea behind having a technical assistance provider, is to help level that playing field. And then with the capacity building pilot projects and the implementation pilot projects, I'm sorry, I don't remember the numbers off the top of my head now, but that there are some projects that essentially are going to need to take more time to be able to kind of get themselves up to speed. And so the capacity building pilot projects, that is designed for those projects that may need some extra time and attention in order for them to kind of ramp up to where the implementation pilot projects may already be. So it's really an effort to try to make sure that those organizations that have in some ways kind of been locked out of being able to receive these kinds of funds and to demonstrate what it is that they're doing and the effectiveness will have the opportunity to do so.
Thank you for clarifying that. I asked in particular, thinking about our participants, that they may be potentially in a position or interested in fit that criteria of the capacity building projects. Our intention was to help build some of that capacity.
Right. We don't want people to feel overwhelmed by interacting with the state system, which is very cumbersome, you know, and it can be very intimidating for folks who haven't done so before. And so it is a way to kind of ease people into the system on their terms.
Great. Great. Well, thank you, Tamu. Are there any other questions? I know it's a lot of like wait and see what happens, but at least we have with this presentation, you'll have the places to look into it, to start preparing, and information about how you could be sign up so that you stay tuned in everything that happens. So
yes, if you haven't signed up to get the e-blast, I would highly recommend that, so that as there are updates, you will be the first to know.
Well, not seeing any other questions. I think we'll end early because there isn't much more that we can say about this right now. So. But we do want you to be aware of it and be tracking it so that you can be prepared.
Yeah.
We did get one more.
I guess my invitation would be, yes, I think we're definitely ready to.
There's one more.
Oh, there's one.
Can you clarify one more time the phase 1 process at community-based organization level?
So, Sine, the phase 1 has already happened, and you want to know more about the history of how community-based organizations were involved in phase 1? What was the involvement of community-based organizations in phase 1? Is that your question? We're hoping to get some clarification from you, Sine, on there we go. Now it's Bruce. Let's see, Sine. I want to make sure that we all are completed phase 1 or something else.
So at this point, there isn't anything left to do for you for phase one. Thank you if you participated in any of the opportunities to provide input, working with the strategic planning work groups or in the forums to provide input on the draft strategic plan. That process is being essentially tied up now with our facilitator writer, the California Pan-Ethnic Health Network. So as Will said, it's really a matter of kind of staying tuned to see what that final strategic plan looks like. And now we're all moving our way through phase two, which is issuing these funds so that we can roll out the projects in the communities and evaluate them.
The other thing, I'm not sure if this is implied in your question, Sine, so let me just address this just in case. Make sure there's some understanding of the difference between what we are doing at CIBHS, funded by the Department of Healthcare Services, and how that overlaps or complements or ties into, but is still different than what the state is doing through the Office of Health Equity, which is in the Department of Public Health. So, because when you say we are all completed phase one, I wasn't sure if you meant we, those participants in the CIBHS project. So if you meant that, the participants in the CIBHS project are not doing anything directly tied to the work of the Office of Health Equity and the California Reducing Disparities Project. So we are not working this is not a part of the California Reducing Disparities Project. So, so the statewide California Reducing Disparities Project, which was started by the Department of Mental Health, they launched it. It was a decision of something that needed to be done as statewide dollars for prevention, the earlier mentioned Mental Health Services Act. There also was a suicide prevention project. There was a stigma and discrimination reduction project and a student mental health project. So these are big statewide projects. The suicide prevention project resulted in the development of a suicide prevention plan for the state of California. Stigma and discrimination did something similar or put something together that was like a plan. And so they also wanted to develop a plan, a strategic plan for the reducing disparities. So that was all done by the State Department of Mental Health. They got that going, and that was done in the process that was presented to you by Tamu. There was the goal that the plan wasn't going to be it, that all along there was money that was appropriated from the PEI, Prevention Early Intervention dollars, because it took a while from 2005 when the MHSA started to 2009 and 10 when the guidelines were released for prevention and early intervention. Money had accumulated, and they decided that we're going to take all this money and use it for statewide, or these statewide projects, and counties would then be drawing down their own money for their local PEI projects, but they had money for the statewide projects. So strategic plan was only phase one and didn't use any of that money. It used administration funds from that was assigned to the Department of Mental Health at the time to do that phase one strategic planning process. And now, many, many, many years later, well, I'm exaggerating, but 10 years later, we are finally going to be implementing some of those dollars that had been agreed upon for reducing disparities. Meanwhile, the dollars that have been set aside for stigma prevention and student mental health, those have basically all wound up or winding up this year. They're being run out of the CalMesa, the California Mental Health Services Authority, which is a joint powers authority between all the counties, and they are wrapping up their initial funding that was provided from the statewide projects for suicide prevention, student mental health, and stigma and discrimination. They're finishing. We have yet begun to do the initial money that was set aside for reducing disparities at the state level, statewide level. So those things, that's what this is all. That's what this is all about. However, we at CIBHS have been doing capacity building for community-based organizations in the area of, well, culturally focused, ethnic and culturally focused CBOs. And so, And so we were funded to do this project to help CBOs build their capacity in advancing their community-defined practice. So this was done kind of inspired by, informed by this greater work that's happening at the state level, but is not a part of that work. So now we want, yeah, you're saying yes, that is your question. How relevant is our CIBHS capacity building participation to phase one? So, so your work for us had nothing. Phase one was already essentially completed. It had been completed a while ago. That draft strategic plan was actually completed maybe 2 years ago or a year and a half ago. It's been in agency review for a long, long time. Was finally released in November or December for public comment.
Right.
So really, phase one had ended, I'd say, at least a year ago, if not 2 years ago. So the work that you're doing with us at CIBHS is, again, more inspired by or informed by phase one, but not a part of phase one. It's not directly connected to phase one. But now, Sine, you guys might be well positioned or better positioned than you would have been prior to this TA capacity building that we've given you to participate in phase two. So this is where you can reconnect to what's happening at the state level. All community-based organizations can be poised to participate in phase two, depending on where they are. But we're hoping that through the work that you've been doing in refining your community-defined practice, that you will be more encouraged to take advantage of this opportunity than you might have been before. So we're hoping that you will feel you know, inspired and do want to track what's happening in phase two and do want to consider participating in the phase two opportunity. Did that help clarify? Is that your question? Okay, great. Sorry, I thought I was hearing something else. Yeah.
Yeah, that was perfect.
Okay. Did that stir up anything else for anyone else, or are we? We have a few more minutes of our allotted time available, but if there's nothing else, then again, I just want to encourage you all. I'll talk for a little bit while I see if anyone else types anything. But again, I want to encourage you all to continue refining your practice, making it something that you can promote with your county, with foundations, with health plans. Keep looking for the opportunities, people who are interested in really advancing culturally relevant approaches. And the better you are at articulating your practice and presenting the evidence of your practice, and if you're ready to disseminate to other locations, then the better you are able to take advantage of whatever opportunity comes your way. So we hope that you will continue the work that you're doing. We're available to the end of June to help you in refining your work. But also, again, we encourage you to stay tuned to what's happening in the California Reducing Disparities Project for any opportunities that might arise for you. Not seeing any more comments or questions, then I'll say please continue to contact us and share with us how you're doing, even after June. And I want to thank Tamu for taking the time to present. I know it must be so hard to be limited in what you can say and still want to share the opportunities and the information. So I thank you for doing that under those conditions.
Absolutely.
And Christy, thank you for opening us up. And I don't know if there's anything else you want to say to close.
I just wanted to thank our presenter as well.
Sure.
Thank all of you for being on the line. And so it's been a pleasure working with all of you. And please make sure as you disconnect to take a few minutes to just share your quick feedback about today's webinar. And with that, I think
in the evaluation form that will be.
I believe it will pop up either as you exit the webinar or evaluation, or you'll receive an email related to that. But with that, I think we're done.
All right.
Okay. Thank you all, and good luck. Good work.